So I'm going to ask a question of Stella. And we heard a lot about stakeholder inclusion in the examples that were presented to us today. And you probed a little bit into this in the panel that you moderated. But I wondered if you could talk more broadly about what it takes to really do that formative work, to engage in participatory model building with stakeholders and community members. What's involved before you can even begin the process and as you actually roll it out?
Yeah, sure. Thank you, Chris. So to give a little bit of context, I am a health disparities researcher, so I'm also not a modeler, to sort of echo what Jamie was saying, but I do work closely with a systems engineer who does agent-based modeling, and we have a project together, and we're embarking on some newer projects. But really, when I was hearing Joel speak about the sort of partnerships and how the sort of partnerships came about, it was like he was talking about my own experience. So just to give you a sense, I work in the Center for the Study of Asian American Health, where we have been working in partnership with the Asian American community and community-based organizations for over 15 years. And so that, sort of to echo what Joel was saying. And then, right now we are in the process of embarking on group model building exercises to learn about healthy diet and lifestyle behaviors amongst older immigrant communities in Brooklyn. And to sort of work backwards from that and to sort of give a sense and give the audience a sense of like what it took to sort of get there is that, there is that 15-year sort of relationship that we have where we have been having these back and forth conversations with the community-based organizations. And even just our center's focus on healthy aging to begin with is literally, something that was coming out of the community voices. That being said, I do want to just sort of emphasize that, for those who are listening who may be sort of intimidated by this process, I think that a lot of these relationships that we're talking about probably already exist. That you probably already have a lot of the relationships, within your wheelhouse, or some of these systems already exist and are in place. But the participatory system science process, in my mind, is just sort of a tool to sort of organize all of it, and to organize that in such a way that you could actually all work together in this sort of structural way to move towards priorities that are all shared, either shared priorities or differing priorities and that kind of thing. But I think that I sort of mentioned this before on the policy panel that yes, it does take time to make these relationships. And I think, to echo again what Anna said, like a lot of it can just start very organically, through a conversation. You see a community-based organization in your town or your city that is interested in the population that you want to work with, or is interested, has like a sodium project, and you're interested in doing sodium work at the health department. So, simply making those connections and having meetings and talking about work, it sounds so almost overly simplistic, but that's really how we sort of start, and then it sort of builds upon itself, right? Like you as a researcher, or you as a stakeholder in government or community, everyone has a different something to offer and bring to the table, right? So, we work together with community-based organizations that really want to collect data. And so they have this trusted relationship with the community, but we have the ability to give them REDCap and to do Excel spreadsheets and to do analyses that maybe they want to do, but they don't have the capacity or the time to do. So that's sort of like, I guess the point is that there's 2 points I want to make. Number one, I've made this point earlier today, but all of this relationship building and maintenance takes a lot of time and energy and effort. And again, it's not just about like a research study. It's about doing something that will have long-term sustainable change where the community is actually engaged. And then the second thing I'll say is that, we found this to be particularly an effective model to engage with communities that are not well represented in the health literature, in the policy space, in all sorts of different sort of administrative conversations. And as our population becomes more and more racially and ethnically and, age-wise diverse, we really need to have solutions that incorporate voices from many different people, because otherwise, we're sort of going to be stuck in the same cycle. So that's sort of what I wanted to say about that whole process.
Thank you. Certainly true for me. I've been doing this work for a long time, and I think helping people appreciate that the investment is worth it is really important.